Foreign funding still plays a critical role in research and development in Africa, and majority of countries are still short of their commitment to invest 1% of their GDP to this sector. The ripple effect, the continent loses at least 20,000 professionals to high-income countries where there is available funds for research and development, according to the United Nations Education and Science Agency, UNESCO. The scientific conference brought together the first group of scientists trained under the first sub-Saharan-wide coordinated program to support African-led research.
So clearly, we have been able to bring in a Nobel laureate. We've been able to bring in Africans who are working in the diaspora, who are doing research at the highest level. And of course, we've been able to bring in the students. And the fact that they've been interacting amongst themselves, it means that it promotes what we want to see, intra-Africa collaboration.
DELTAS Africa is also working with the African Union through its development agency, NEPAD, and African universities. For the first 1,500 researchers, priority is on diseases that most affect the continent.
We want the African governments to bring in funding just to pledge some little amount of money, and we can be able to add to that, use the money that we get from our partners. But what is important is that the research questions that would be addressed by researchers would be relevant to the situation on the ground.
The results promising.
There has been a very good outcome relating to HIV testing from one of our DELTAS program. And they've been able to come up with a method that they can use to test for HIV, which is much cheaper than the conventional method.
Focus will now shift to translating these results into policy, key in changing Africa's health demographics. Over a period of 5 years, the program hopes to have at least 1,500 researchers in the pipeline. Sarah Kimani, SABC News in Dakar, Senegal.